Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Beck Hopelessness Scale assesses negative expectations about the future and feelings of hopelessness. It evaluates cognitive components related to despair, pessimism, and lack of motivation. The main purpose of the scale is to identify individuals at risk for suicidal ideation and behavior, particularly in patients with major depressive disorder. It is widely used in clinical settings to monitor changes in hopelessness during treatment. The scale provides quantitative data to inform risk assessment and guide intervention strategies. The Beck Hopelessness Scale is indicated for patients experiencing depressive disorders, particularly those with major depressive disorder and dysthymia. It is also useful for individuals with suicidal ideation or a history of suicide attempts. The scale is employed primarily in psychiatric and psychological clinical settings to assess negative expectations about the future. It aids in identifying patients at elevated risk for suicide by quantifying feelings of hopelessness, which are strongly predictive of suicidal behavior. Its application extends to medical populations with chronic illnesses, such as cancer or HIV, where hopelessness is associated with poorer psychological adjustment and treatment adherence. The Beck Hopelessness Scale consists of 20 items designed to assess negative expectations about the future. Each item is a statement requiring a true or false response. The administrator instructs the respondent to read each statement carefully and mark true if the statement applies to their feelings, or false if it does not. Responses that indicate hopelessness are scored as 1 point. Conversely, responses that indicate the absence of hopelessness are scored as 0. After completion, individual item scores are summed to produce a total score ranging from 0 to 20. Scores from 0 to 3 indicate minimal or no hopelessness. 4 to 8 represent mild hopelessness, 9 to 14 suggest moderate hopelessness, and 15 to 20 reflect severe hopelessness. Higher scores correlate with a greater degree of negative expectations and are associated with increased risk for depressive symptoms and suicidal ideation. The scale should be administered in a quiet environment to ensure accurate self-reporting. The Beck Hopelessness Scale demonstrates variable sensitivity and specificity depending on the cutoff scores and population studied. Sensitivity refers to the ability of the scale to correctly identify individuals who are experiencing significant hopelessness or are at risk, meaning true positives. Specificity refers to the scale's ability to correctly exclude those who do not have significant hopelessness, meaning true negatives. Studies report sensitivity values ranging from 0.70 to 0.85, indicating that the scale correctly identifies 70 to 85% of high-risk individuals. Specificity values generally range from 0.65 to 0.80, reflecting that 65 to 80% of those without significant hopelessness are accurately classified. For example, in a clinical setting using a cutoff score of 9 or higher, the scale may identify 80% of patients with clinical hopelessness, while excluding 70% of patients without the condition. These metrics support the use of the Beck Hopelessness Scale as a reasonably accurate tool for screening hopelessness, although performance may vary based on sample characteristics and scoring thresholds. The Beck Hopelessness Scale was developed in the mid-1970s by Aaron T. Beck and colleagues as a self-report inventory designed to measure negative expectations about the future. Its initial validation involved samples of psychiatric inpatients, demonstrating strong internal consistency with Cronbach's alpha coefficients typically exceeding 0.9. Subsequent studies have consistently shown the scale's construct validity through significant correlations with related measures of depression and suicidal ideation. Predictive validity has been supported in longitudinal research, indicating that higher scores on the scale are associated with increased risk of suicide attempts and completed suicide, particularly among depressive populations. Cross-cultural validation studies have also substantiated the scale's reliability and validity across diverse clinical and non-clinical groups, with test-retest reliability coefficients generally reported in the range of 0.7 to 0.8. These findings underscore the Beck Hopelessness Scale's robust psychometric properties and its sustained relevance in both research and clinical settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.